Hello, good evening, everyone in India and nearby. Good morning, everyone who have joined from rest of the globe. My name is Atri Gangopadhyay. I am a pulmonologist based at Ranchi. I am the East Zone Governor and National Spokesperson of Chest Council of India. Today, we are trying to bring a discussion that has never been attempted before in recent as per our meticulous search of the internet. Today, we are going to discuss the challenges in pulmonary health with respect to environment change, with respect to climate change. There are lots of discussion on climate change. Recently, there was a international sports event which India won, where lots of matches were affected due to climate change, and that maybe affected fortunes of certain teams participating there. Now, how does this climate change, how does this environment change affect the lungs? And to discuss that, we have a star studded cast representing various parts of our country that may actually have different climate at one point of time. We shall have two lectures initially by Dr. Ravi Dosi. Dr. Ravi Dosi from Indore, he was one of the stars against COVID during the horrible time which we would never want to face again in our lifetime. But he has also done lot of work with respect to environment change, and he is doing some new research on climate change which we will come to know in some future conference. After Dr. Ravi Dosi, there will be another talk. We have a guest pediatrician today with us, Dr. Sourav Sarkar. Dr. Sourav Sarkar comes from the gateway to the famous hill station of Darjeeling and Sikkim. He is working with Indian Railways based at Alipurduar, West Bengal. After these two talks, we shall have the live panel discussion. And as we go, I shall keep on introducing our other participants. So, over to you, Dr. Ravi, for your lecture.
Thank you, Dr. Atri, for that wonderful introduction. A big thanks to Dr. Krishna sir, CVK sir, Kirat ma'am, and Shivani ma'am for giving me an opportunity to talk on a very, very important topic, which is climate change and respiratory diseases in adults. Climate change is considered the biggest health threat facing humanity in the 21st century. Climate change is a reality. It is nothing that we foresee in the distant future. It is actually happening. Our Earth is warming, and by 2100, there will be a 2 degrees rise as compared to when we were in 1900s. This small change in the average temperature of Earth leads to large and dangerous shifts in climate and weather. This causes changes in the rainfall, resulting in more floods, droughts, or intense rain, as well as more frequent and severe heat waves. Climate change causes a lot of changes in rainfall, wind flow, velocity, dry lightning, and temperature variations, which lead to long wildfires in the forest areas with increased intensity, causing increased carbon emissions, biomass changes, which in turn contribute to the green gas emissions, ambient air pollution, and which in turn affect the respiratory health of patients. Not only patients, it's the general public at large. And day in, day out in newspapers and the media, we hear of things like the greenhouse effect, the El Nino, La Nina. These effects are relatively new, but these are the outcome of the rapid industrialization and pace of growth that humanity has given. And this is how the environment is responding. This is potentially dangerous, and air pollution is having an increasing impact on human health. Nearly every person on earth breathes unhealthy levels of air pollution, even with far reaching health implications. It is a very, very dangerous situation we are in, and the most of the brunt is borne by those people who are working in fields, who are working in outdoors, or who are working with relatively more exposure to outside environment. This is a very dangerous situation. As you can see, air pollution has now become the second most important global risk factor for death overall in the world, as well as in children under 5 years of age. The main causative agents are methane, nitrous oxide, carbon dioxide, ozone, and water vapor, which is released as a result of this increased temperature. This contributes to the air pollution. The air pollution originates predominantly from industrial pollution, land use which was previously forested area, buildings coming up at several places, transport, and other energy sources which are being used. Respiratory health is affected by air pollution as it directly exacerbates asthma, COPD, and pneumonia. Aeroallergens, pollen, and mounds are affected. Extremes of heat and cold occur more commonly in the whole year, leading to more respiratory morbidity and mortality. Floods and natural disasters happen more commonly, causing financial losses and extreme emotional stress, thereby causing downgrading of the control of asthma. Climate change causes change in both local weather patterns as well as change in frequency of extreme weather patterns. बहुत ज़्यादा बारिश, बहुत ज़्यादा ठंड, बहुत ज़्यादा गर्मी. What we have been through for the past 2 to 3 months. This change in atmospheric concentration of pollutants like ozone, particulate matter, sulfur dioxide, nitrous oxide, and carbon monoxide causes several interaction with the weather allergen, and this weather allergen interaction in turn causes several problems on the respiratory health like premature mortality, allergic responses vary and become more severe, exacerbations of chronic diseases like asthma, COPD, occurrence of newer respiratory diseases, decline in the lung function of a patient, and increased prevalence of lung cancer. Particulate matter is an important cause of air pollution. Particulate matter affects from the top to bottom. The larger size particulate matter affects and infects the upper respiratory tract. As they go through the tracheobronchial tree, they even affect the alveoli. Particles which are less than 0.1 cause alveolitis and long-term changes like COPD and lung cancer. And lower respiratory tract is affected, causing more severity of asthma, COPD, and increased prevalence of pneumonia. The most important biological component of ambient air is pollen, and this is a very common finding which we see post rainy season. Its allergen is the driver of airborne allergen diseases. The main effect of climate on pollen are an increase in plant growth, increase in amount of pollen, increase in amount of allergic proteins, earlier and longer pollen season that the person has to bear with, change in the distribution of pollen, and most importantly, an increased fungal spore production. The air pollution, when combined with the winter season, gives rise to a very, very deadly situation in which there is aggravation of chronic diseases like asthma, COPD, lung cancer, newer diseases like cardiovascular and cerebrovascular accidents can happen. Patients develop more of upper respiratory tract symptoms, and there is a higher long-term risk to pregnancy. Pregnant women in their premature births may happen. The child may be born deformed, or there may be an overall increased incidence of lung cancer. What are the health effects of climate change? What's the big deal? Well, the big deal is the magnitude. Over 3 billion people live in areas highly vulnerable to climate change. There is an increase in heat-related deaths and illnesses, as we have seen recently in the northern of India. Lot of heat wave-related deaths have happened. There is a threatening to the water and food security of a region. Warmer climates create an ideal condition for infectious diseases like pneumonia to spread. There is an increase in allergy and harmful pollutants in the air. And many people are currently already experiencing these issues which I am talking about with an increased severity. And we have to realize that even a small shift in the global heating of as less as 1 degree will also cause major increases in health. Of all the climates, heat is the biggest weather which is of most concern not only to children but even their caregivers. What does it cause? Short-term exposure to air pollution or climatic change in terms of heat causes coughing, wheezing difficulty, eye irritation, headache, dizziness, fatigue. Long-term exposure causes diseases like asthma, emphysema, cardiovascular damage, harm to the liver, spleen, and blood, nervous system damage, cancer, birth defects, and death. It is a massive threat to respiratory health. It promotes or aggravates respiratory diseases. It increases exposure to risk factors for respiratory diseases. And the climate change, like I have already told, triggers allergy cycles, which are absolutely new for that particular area, which a person has to bear. More so exposed to this particular problem is the migrant population. Suppose somebody shifts from somewhere to some place for the purpose of working over there for his occupation. They have to face a totally new environment. People coming from villages to cities face a huge challenge as far as the respiratory health is concerned because of these factors. The main diseases of concern due to air pollution are asthma, rhinosinusitis, COPD, respiratory tract infections, both upper and lower. The people who are most affected are those with the existing cardiopulmonary diseases and those who are disadvantaged. They're like extreme elderly, patients who are handicapped or bedridden. Indoor pollution is also a very important source of pollution, and we can see almost all the parts of the home contribute to indoor pollution. Sources are chulhas, tobacco smoking, dust, mosquito repellent, wall and furniture paint, agarbatti burning, wood and paper burning. Effects of indoor pollution are as bad as those of outdoor air pollution, like confusion, headache, anxiety. The viral incidence goes up in those homes where there is higher indoor pollution, causing sneezing, coughing, nose irritation, COPD, asthma might happen with more frequency in those homes. Heart ailments, genetic disorders in babies, and lung infections are very common where there is high prevalence of indoor infection. We have to remember that there are various available alternatives like solar energy, proper use of electric power, use of LPG, use of biomass fuels, use of alcohol fuels, and using stoves with low gas emission. It is very important that we take care of the climate change. As recently, CCI Con has happened in Srinagar, where everybody has appreciated the climate. And next CCI Con is posted to happen in Kolkata, where climate is a really challenging situation. With this wish of having a very good CCI Con in Kolkata, I would now like to hand it over to Dr. Sourav for telling the effect of climate change in the pediatric population. Thank you.
Hello, good evening everyone. Today I am going to present how climate changes affect pediatric population. So climate change poses a great threat to child health globally. The strongest effect were temperature extremes increasing preterm birth. Respiratory disease, mortality and morbidity are also affected by climate. Global climate change is occurring and will impact everyone. Its impact will be harder felt on children and hardest felt on certain categories of vulnerable child, including those living in areas threatened by variation in rainfall, temperature, or hurricanes and cyclones. As products of fuel combustion, forest fires, and agricultural activities, air pollutants such as ozone, nitrogen oxide, sulfur oxide, and particulate matter have adverse respiratory effects. Worldwide asthma rates have doubled in the past 15 years, with the greatest rises in children, particularly in African American population. Some of this doubling was likely due to increased pollutant concentration. So cough and asthma are initiated and exacerbated by ozone. Ground level ozone produces respiratory tract inflation, reduces the lung function and aggravates chronic respiratory disease. Children exercising in high altitudes environment are 40% more likely to develop asthma, and reduction in ambient zone ozone concentration are associated with reduced pediatric emergency admissions. According to WHO, 5 million children die annually from disease linked to air pollution. Compared with adults, children breathe more rapidly and more often play outdoors, leading to greater exposure to pollutants per unit mass. Their narrower airways result in more tissue exposure per volume inhaled and more inflammation. Further exercises increases breathing through mouth rather than the nose, which filters approximately half of pollutants. Polluted air goes straight to lungs, increasing parenchymal damage. Because children's respiratory system are still developing, this damage can have longer term impacts. Because children have less self-awareness than adults, they also often do not stop playing when they experience respiratory difficulty. As the monsoon arrives, the sudden change in weather brings along increased humidity and increase in infection, and making both children and adults more susceptible to respiratory issues, including productive coughs. This type of cough, characterized by the presence of mucus or phlegm, can be particularly uncomfortable and concerning. Exposure and sensitization to pollen cause hay fever, allergic rhinitis, and allergenic asthma. Aeroallergens also trigger and exacerbate asthma, especially among children. Higher atmospheric carbon dioxide concentration and warmer temperatures are likely to increase ambient pollen levels. Allergies are associated with increased atopic sensitization. Sensitized individuals are confined indoors during allergy season to avoid allergic symptoms. Development of allergies is strongly correlated with allergen exposure in early life. Early atopic sensitization can also lead to asthma. Children therefore have greater susceptibility to and longer morbidity from this condition. Prevalence of hay fever and asthma have increased significantly in recent decades. Pollen counts are rising, possibly due to increased carbon dioxide level, warmer winters, earlier spring seasons, and/or nitrogen excess. Here you can see we have discussed about the respiratory health. So here we can see the interrelation. Here air pollution, aeroallergens, pollen and molds, extremes of heat and cold, and flood and natural disasters, which can lead to all these infections, asthma, allergic rhinitis, the respiratory morbidity and morbidity. So our take-home message is children are different from adults, so they will suffer more from climate change. Climate change could therefore increase the incidence of childhood allergies and asthma. Other factors related to climate change are proximity of high-risk zone like coastal areas, glaciers, snowfall areas. Financial and social resources determine protective system to climate change. Poor sanitization and drainage system, they also worsen flood, storm situation and indirectly affect child health. Thank you.
Thank you, Dr. Ravi. Thank you, Dr. Sourav, for such an excellent rolling the ball so that now we can go to the discussion. From center of India, we move to the foothills of the Himalayas. And now I would want to introduce someone who is not only a very senior pulmonologist, he is also a fitness enthusiast. He is known for cycling long distance, hundreds of kilometers in very short duration of time, and he tries to do that regularly. So I would want to introduce Dr. Ashutosh Gupta. He is from Prayagraj, Uttar Pradesh. Dr. Ashutosh ji, as per your understanding, what is the primary mechanism by which this climate change can cause or worsen a respiratory disease?
Namaskar. Thank you, Atri Bhai, for wonderful words. And thanks to CCI Krishna sir, Dr. Ravi sir, and Dr. Sourav for excellent presentation. So there are basically three things that cause climate change, worsen respiratory health. First is the increased surface temperature. Second is extreme weather events. And third is the air pollution. Increased surface temperature leads to generation of higher level of ozone as well as higher level of pollens and bioallergen burdens resulting from a longer and more intense flowering season due to increased surface temperature. Second is the extreme weather events such as the flooding or burning, hurricane leads to increased fungal growth and water damage. Droughts also can cause wildfire that further release large amount of carbon dioxide and fine particulate matter. Third is the air pollution, as we already know, that as Dr. Ravi Dosi sir said that the major composition of air pollution is carbon monoxide, nitrogen dioxide, sulfur dioxide, ozone, and particulate matter. We all know that particulate matter, especially less than 2.5 micrometer, is a diameter that is the most significant. And because it can deposit any area of respiratory system and also can travel to the vascular system. So pollutants may lead to increased bioavailability of airborne pollen allergens, adding to morbidity of patient, especially of asthma patient and COPD also. These are the primary three mechanisms that can cause increased respiratory distress or respiratory distress due to climate change.
So, dear audience, please remember these three things. One is drastic changes in temperature.
Yeah.
Second is growth of fungus. And third is change in the air composition due to various pollution. India has a hot and humid desert at only one state, that is Rajasthan. So from Prayagraj, Uttar Pradesh, I would want to move on to Rajasthan, the gateway to the desert, gateway to the kings and maharajas, Rajputana area. We have Dr. Anirudh Saini. He is a very fast becoming famous pulmonologist at Jaipur, very sought after by bigwigs over there. So Dr. Anirudh ji, whenever
Good
we
evening,
are
sir.
talking about this climate change, impression always comes regarding increased use of air conditioner. So how can you correlate this increased use of air conditioner to our topic today?
Well, sir, the use of this excessive use of air conditioners is a kind of climate change. What I understand about is that if a person is sitting or staying in an air conditioned room or hall for prolonged duration, then the climate in which his or her body stays, it changes. Like there is the quality of air is being controlled, the temperature is being controlled, there is lack of sunlight, which is an important issue, and the same air it is being circulated again and again. So all this can make us more prone to infections. One of the well-known such infections in the cool rooms, which is a Legionella infection, which happens in those cooling systems which utilize water as a coolant. But as such, other infections, the transmission of infection can be there because the same air is being recirculated again and again. Also, another thing is that if the filters or the ducting system are not cleaned of the air conditioning units, then it can cause growth of mold or fungi, and it can cause infection. Also, the different kind of dust settling into the filters and the ducting system, they can cause allergic problems. Another thing that some unconfirmed reports, which data which we have come across is that like this lack of sunlight, this lack of fresh air, and this sitting in an uncomfortable temperature for prolonged duration, it to some extent it decreases the immunity to fight different kinds of infections. So this also plays what I feel is plays a role in pathology, respiratory pathology. So this is what my take on this topic.
So thank you. One thing we should all perhaps admit and realize is air conditioner may be indispensable. Currently, I am giving this webinar from my clinic. There are two air conditioner running currently. In my house, last year there was only one air conditioner. This time, due to the heat wave, I had to purchase two more air conditioner. So, air conditioner cannot be avoided, but cleaning of the same is very important, as impressed by Dr. Anil. We spent lot of time in center India, northeast, east, North India. Now we would want to move to way south, to the last stretch of India, the place which is nearest to the equator, the place that is nearest to the sunshine. And Dr. Anirudh was telling that nowadays, due to climate change, people are forced to get less sunshine. So we have from Kerala, Thiruvalla, Dr. Tony Liu. He's a wonderful pulmonologist. He's a one-man army. Means in his hospital, he is the resident, is the pharmacist, he is the registrar, he is the consultant, he is the manager, he is everything. So Dr. Tony, although you're coming from Kerala, can you tell us that low exposure to sunlight leads to vitamin D deficiency, and has that any role in these climate change related topics?
Good evening, everybody. Thank you to Krishna sir and the CCI team for this opportunity. I would like to first impress that being in Kerala is not a benefit for the vitamin D3, because even here we're not going out to the sunlight to get exposed to make the vitamin D3. Vitamin D3 is a basic test I do in every single patient who comes to my OP, and 99% I find there is a deficiency. And the problem with that is, for example, today I had a patient from UK whose reading was only 15. When in India itself, the basic we say is that at least 30 we need. We have to maintain between 30 to 50 reading. So now the what I have felt throughout my practice is that the moment we start supplementing with vitamin D, even the overall respiratory diseases itself, we find a lot of improvement to the baseline other treatments that we are giving. And for example, what we should understand is vitamin D itself, it regulates more than 200 genes, including genes for cellular proliferation, differentiation, and apoptosis in our body. And it plays a very important role in the innate immunity. It improves the host defenses along with the surfactant protein A and D. And this improves the phagocytic technique of the body, the viral clearance. In chronic disease, it also modulates the ongoing abnormal immune responses and improves the functionality. And there was a study which I just found with this Mehboob et al. It was saying that it improves the steroid response also by increasing the expression of the glucocorticoid receptor and reducing the blood levels of asthma-related cytokines like IL-17F and IL-4. So most of our diseases, COPD, asthma, as we all know, we use steroids quite frequently as a part of the treatment. And the problem with using steroids is it also causes the deficiency of vitamin D3 to exacerbate. So most of us would have had patients who have started on treatment and they come back with the complaint of joint pain, muscle cramps. So these are maybe even hair fall. Especially in these situations, you have to look for vitamin D3 and correct for the overall improvement of the patient. And also in our elderly patients where we are giving, maybe we'll need steroids more frequently, in their skin, there is decreased concentration of the 7-hydroxycholesterol in the skin, which again reduces the capacity to have vitamin D3. And the problem is, we know even in the food, what we say is to have milk, to have fish, but we remember vitamin D3 comes only in oily food, not it doesn't get stored in other food components. And even if you are giving, for example, you have to give vitamin D3 with calcium to improve the absorption of the vitamin D3. And if you're giving vitamin D3 to the patient, you have to ask them to at least drink it with a glass of milk. That is to improve the absorption of the vitamin D3 itself that you're giving. And once you give the correction correctly, let us say how I practice is, I give a basic course for maybe 3 months. After 3 months, I'll give a break for a month. And then I recheck the vitamin D3 level and then only recorrect again for that. But this has to sustain. Even in pediatrics, in small children also, it gives so much reduction in the exacerbations the children come back with. And the amount of improvement they show in the inhaler is also significant. You need much lower doses of inhalation medication to improve the child. And even in adults. So I will highly recommend that everyone should do a vitamin D3 basically for every single patient who walks to your OP. But the only problem is if the cost could come down a bit for the test, it is almost minimum around 1,000 rupees to do a vitamin D3. It would be much more easier for us to do the treatment.
Thank you. So one very important thing I came to learn that there is sunlight or there is no sunlight, vitamin D deficiency will still be there. We must recognize vitamin D deficiency even when there are no symptoms, and giving the medicine with milk increases the absorption. And maybe Chest Council of India should appeal to all our lab partners and lab friends that try to reduce the cost of this test, because this is something universal. One point I would want to add here, I had a very long day today. There were 3 hemoptysis cases, young adults. I had to do 2 bronchoscopies. And I always keep this habit of having some lassi curd milk pouches, Tetra packs with me, so that every 2 to 3 hours, I can take a sip of one of those pouches. So doctors who are overworked, doctors who may be suffering dehydration, you can also have this practice. This is something healthy. This will keep you hydrated at least. This will keep you cheerful also. From Dr. Tony, I would want to move to our guest today, a pediatrician, Dr. Sourav Sarkar. He has traveled half of India for his education. After doing his basic education from Guwahati, Assam, he traveled to Gwalior, Madhya Pradesh to learn pediatrics. And now he is employed with Indian Railways and he is at Alipurduar, just at the gateway to Darjeeling and Sikkim. We have a guest question from you, Dr. A.S. Rangarajan from Coimbatore is asking you that what is the youngest age you see respiratory allergies and what may be the role of Montelukast in this climate change susceptible children as a prophylactic. Dr. Sourav, your inputs, please.
In less than 2 years, we can see the allergies, especially the ones who are exposed to allergens and pollens. And what is the next question, please? Role of
Montelukast as prophylactic for these children, especially this climate change time. Role of Montelukast for these children.
It acts as an anti-allergic for this susceptible in case of allergic rhinitis and asthma, and it should be given for a minimum of like 3 months prophylactic.
Okay. Anyone else want to add here? Any of you who may be adult pulmonologists but still see some kids, any of you would want to add here?
Montelukast in pediatric.
Dr. Please.
Dr. Ashutosh, boliye.
Yes, Montelukast in pediatric population nowadays cannot be given long-term basis because it also has some psychiatric issue in children had been seen. So, though we can use in children with climatic change for prevention of, but duration, how much duration can we give? It is debatable topic.
Okay. Since I started using oscillometry, I started seeing lots of children, and then I realized that children as less as above 1 year are suffering respiratory allergies, and giving Montelukast, let's say 7 days, 10 days, 15 days is actually not hurting them. Yes, there is a black box warning with Montelukast, I would agree. But if you ask me in my practice, I am yet to see a case of psychiatric disturbance that has been attributed to Montelukast. I would not want to criticize anyone, but maybe these studies were done in Western countries with broken homes where children were already predisposed to some psychiatric issues, and then they blamed it on Montelukast. You never
agree.
So that is playing the devil's advocate. But yes, if there is a black box warning, it is our duty to tell our patients the same. I would want to move to Ravi sir now. Would you agree with me that you are seeing more of fungal chest infection nowadays? And what may be your observations regarding the same? Dr. Ravi.
Very pertinent question, Dr. Atri. In one of my slides, मैंने एक छत दिखाई थी जिसपे पूरा it was all sealant and fafun. A very common sight which is seen post rainy season. But you know, this is one of the things that fungus is also expanding its footprint geographically because of the increased temperature, increased humidity levels that we are having nowadays in most of the time. There is a lot of population moving around. So because of this overcrowding and low hygienic conditions, people are living in such debilitated houses where they are exposed more to such sort of furniture and homes where fungal spores and molds are much more in quantity. Extreme climate changes, like even we are talking about asthma exacerbation in this recent past 1 or 2 months. I think I saw all those asthmatic patients which used to come in peaks of winter. So definitely fungal is taking advantage of this extreme climate change, and fungal spores are more in density as compared to the routine period because fungus adapt to heat much better than the other pathogens that we deal with. So they take over a lot of the pathogenic spectrum. Antifungal resistance, most of these molds which are heat savvy, they are resistant to the common antifungals that we use. So that is why antifungals, fungals and fungal pneumonia are being seen much more commonly nowadays as compared to before.
Mute.
Thank you. That's a wonderful answer. One very important thing you told us was regarding overcrowding. So I would want to ask Dr. Anirudh ji,
Yes.
Government of India and all pulmonologists are trying to do lot of work for eradication of tuberculosis. So this environment change, overcrowding, do you think this is having some impact in tuberculosis and drug resistant tuberculosis? Dr. Anirudh ji?
Yes, sir. Thank you. Sir, before this COVID-19 pandemic, TB was the leading cause of death caused by a single pathogen, but now we have seen the COVID. So regarding the overcrowding and TB, whenever we evaluate the quality of housing of any person or patient, we have to take into account certain parameters like the crowding, that is number of people living per square feet of area, and the ventilation condition of that particular house or facility, and also dampness. So all these things, the poor ventilation, overcrowding, and dampness, these all can increase the incidence of infection. And the overcrowding and poor ventilation, they increase the transmission rate of infection from one person to another. There have been like this whole thing revolves around the concept of droplet infection. So in that thing, uh, the things which are important is that the distance that droplet carrying pathogens can cover while it is suspended in air. So that's why the one of the famous slogans during the COVID times evolved "दो गज की दूरी." And another thing to take into account is the time with different kind of droplets or different size droplets. They the time they are staying into the air, suspended in the air before falling to the ground. So the this concept revolves around this. And there have been various studies which have proven that overcrowding leads to increase in incidence of tuberculosis. So there is no doubt about that. Another thing is about the drug resistance, tuberculosis, and overcrowding. So, this poor socioeconomic status, joblessness, and overcrowding, they have been considered a risk factor in the development of drug resistant TB. Also, the people who are staying in overcrowded households or prisons or such or another facilities which like overcrowded hostels, they have very limited access to different kind of resources. Generally, if the resources are considered, then they can be considered poor. So all of these factors, what I think is that they have got a negative impact on the immunity of a person who is staying in such condition. And if the immunity is poor, then even a patient who is a drug sensitive TB patient who is on therapy, they can convert into drug resistant TB while still on therapy. So overcrowding is definitely even proven factor in the pathogenesis of TB and even in the worsening of this tuberculosis.
So one beautiful message comes from here that whenever we are taking history of someone taking medicine for TB or someone with recurrent chest problem, we must keep overcrowding as one of the important history. We must ask, we must probe regarding overcrowding to such people because this is something which is modifiable. Ashutosh ji,
Yes.
this time we often face some dilemma when some hospital worker, let's say, or some neighborhood person or some patient asks us that there is change of season and I'm getting this cough. So please give your guidance regarding this new onset, this cough, productive versus dry cough at this change of season. Ashutosh.
Especially when environmental factors play a role, like a dry atmosphere, air pollution, or sudden change in temperature. It leads to mostly cause dry cough, like cold and dry air also cause throat irritation, cough, mostly dry in nature. Cough only productive, only there is some secondary infection, some viral infection, some bacterial infection, in spite of climate change. Most of the time we get only dry cough. We have to treat it symptomatically. Some lozenges, some steam, or sometimes very irritating cough, we can give inhaled corticosteroid also. But mostly during climate changing, we can get mostly dry cough until unless it's secondary infected with some bacterial or virus infection.
Okay, thank you. So one thing we should try to understand and we should try to reinforce to our patient that change in season, cough is not a sign of antibiotic deficiency.
Yes, sir.
If someone is having cough, it does not mean that this person is suffering deficiency of cephalosporin and we should give that person cephalosporin. Most of this cough can go away with lots of
Yes.
home remedies. And only if there is something worsening or if there is some vulnerability, then only we must consider that. I would want to move on to our pediatrician, Dr. Sourav ji. Whenever we are talking about this climate change, lots of guardians or parents of children ask you that what diet can help us during this climate change. So, Dr. Sourav ji, please guide us regarding some dietary recommendation for children to combat climate change.
We should advise like balanced diet, rich in fruits, vegetables, and fluids to help maintain the immune status. Especially in the age group of 1 to 3 years, we should to maintain hydration. The fluid level should be like 1.3 liter per day, and 3 to 8 years it should be like 1.7 to 1.8 liter per day, and in 9 to 13 years age group, in males it should be like 2.4 liter per day, and in female it should be 2.1 liter. So by this we can maintain.
Okay, so that's some very handy advice, and I am sure we shall also find this helpful for kids in our families. When we are talking about dietary recommendation, I would want to move on to Dr. Ravi Dosi. When he gets time from not seeing patient, Dr. Ravi Doshi is a great food appreciator, and he has highlighted lots of Indore and Madhya Pradesh street food on various social media. He never endorses any brand, but he has endorses lot of those street food. So, Dr. Ravi, the same question for you: that what dietary recommendation would you give to our adult patient whenever we are talking about this climate change problem?
Uh, Thank you, but definitely that food is not on the list which I'm going to tell. It is more of connecting with nature, which we have to take care of in our diet. It is very important that people concentrate on locally available food. वो जो यहाँ अवेलेबल है उस पर ध्यान दीजिए. अगर आप रांची में हैं तो जो है उस पर ध्यान दीजिए. आप केरला में हैं तो जो है वहां पे उस पर ध्यान दीजिए. Eat more of that. Eat seasonal foods. Seasonal foods are always a very nice way to protect yourself from environmental problem because they are full of antioxidants. You should eat more of plant-based foods like vegetables, fruits, legumes, plant products like beans, nuts. ये ज्यादा लेना चाहिए. Meat and dairy products should be consumed less. The processed food should be taken in minimal quantity. You should always have bulk of the diet which is more is plant-based. And always saturated fat like butter, milk, cheese, meat, these should be consumed less. Coconut and palm oil should be consumed less. This particular diet has also been termed as the Mediterranean diet. So, आप environment बचाइए, Mediterranean diet लीजिए.
So that's a beautiful thing that even our diet can protect the environment. One thing which I understood from Dr. Ravi and Dr. Saurav, please use seasonal fruits. That is, if mango is a fruit of summer, and thanks to agricultural revolution, if we are consuming mango in December, January, we can definitely fall. Or if there are certain fruit which are more popular in winter, and if we are consuming them in May and June, we can definitely fall. So please try to consume fruits seasonally, and exotic food should be sampled but not devoured regularly. Like if something is available in Ranchi and people at Kerala are trying to eat that every day, you can definitely fall in. If something is available in Kerala and people at Alipurduar are taking it every day, you can definitely fall. So please respect exotic boundaries. Please respect seasonal boundaries. Other times, tasting is sufficient, but devouring it can actually cause a lot of suffering. So that's something wonderful. I would want to move on to Dr. Tony. Whenever we are talking about climate and environment change, something that always creeps in is air pollution. So, based upon your observation and experience, have you noticed any new dimension to air pollution nowadays that you can correlate with this environment or climate change, Dr. Tony?
If you go on to Google, if you just search, am I audible?
Yeah, perfect.
Yes.
If you go on to Google and search, there is something called an air quality index, AQI level, that you can search for full India. You can search for every state as per the name you enter. This air quality index means what is the amount of particulate matter that is in the air surrounding us. So in that, the most problematic is when you have a micron size of less than 2.5 diameter and less than 10. Both of these or particles are what usually cause more distress for the body because they have more penetration capacity into the lung. Our nose is designed to filter the particles going in, but the smaller the micron size, the easier it is able to bypass that. So usually, the main gases that cause this issue is, one is the ground level ozone. Then we have the dust particles. Then biofuel, what we use as diesel, petrol, all the combustion particles that come out. Dioxide, nitrogen dioxide, and carbon monoxide. So these particles combine to form the air quality index. And overall in the world, India is one of the higher levels compared to other places. And as Ravi Dosi sir said on his talk, as the more where the more poorer people are, where they tend to use more biomass. Like as we all know, Sandeep Salvi sir is the one person who found out the connection to biomass fuel emissions and women also developing COPD in the Indian context compared to anywhere else in the world. And the one reason is because of this pollution, it lingers in the air and we are constantly inhaling it into our lungs. So, and where we talk about in males COPD development due to smoke inhalation and even non-smokers developing due to passive smoke inhalation, air pollution is also a major factor in this consideration. And when you look at this AQI index, it usually comes as a grading, the quality index. So usually if you find the rating from 0 to 50, it means it is a very good air quality. 50 to 200 is a bit on the unhealthy range, but most places have that. Greater than 200 is very unhealthy, where you are prone to develop more diseases. And 300 is actually hazardous. So usually in Delhi, where we might find more smog-related issues due to this pollution, there usually this 300 will be a higher rating. And that is where we develop more respiratory illnesses. Now, overall, in 2023, what was found is, the reading in India is 10.9 times higher than the WHO's annual value, which is actually much higher. And what our government has done is in 2015, the government of India and IIT Kanpur, they launched a national air quality index, which is continuously monitoring this, the way it is developing. And in 2019, they set up a national clean air program with a national target for 20 to 30% reduction in this PM 2.5 and 10 by this year, 2024. And to be compared to the 2017 data, and if we are not able to reduce this, then obviously respiratory physicians have more work to do because they're going to have more and more respiratory cases. And practically, as long as we are outside, if you're going to a more polluted area, we should try to use an N95 mask, the COVID kind of mask, to reduce the inhalation we're having inwards. Along with that, if you're in a polluted city, like for example, Delhi, you have to use a HEPA filter in the house, especially for children in their room. It is always much safer to invest in a HEPA filter to filter the air rather than having recurrent course of medications to treat the secondary infection due to this pollution. Was I clear?
Yes.
Yeah. So that's wonderful. one thing which I understood, that nowadays we are able to actually measure the air pollution. So maybe these indicators should be part of the MBBS syllabus now, that anyone graduating to be a doctor must know these parameters. What is AQI? What is PM? So that is something which should change in our medical education also. The idea for this webinar came from our webinar coordinator, Dr. Vijay Chennamchetty. When we were at the Srinagar CCI Con, he got this idea, looking at the beautiful climate, that maybe climate change, environment change should be a webinar, and that brought the idea of this webinar. So thanks to Dr. Vijay Chennamchetty. From Dr. Tony, I would want to move to Jaipur. Dr. Anirudh ji, nowadays transport is very fast. Just yesterday, the Indian cricket team was stuck in West Indies due to a cyclone. But thanks to fast jet planes, they are back in Mumbai, and currently there is a victory parade going on in Mumbai celebrating the Indian cricket team's World Cup. So if transport is so fast, how can that affect respiratory diseases regarding climate change and environment change? Dr. Anirudh.
Yes, sir. So the different modes of transport like the land, air, and water transport networks, they have been continuously expanding in terms of their reach, in terms of the number of passengers they are carrying, and in terms of the speed of travel. So it has got important consequences, like of course the increase in speed of transmission of epidemics of communicable diseases, and invasion by different vectors, along with the uh, people who are coming, persons, patients, or the cargo, even the cargo that is coming, and also it can cause invasion of vector-borne pathogens. And, one of the famous example, of course, we have just gone past that, like COVID-19, and some other examples are also there, like the invasion by the mosquito Anopheles gambiae, invasion of the Brazil in 1930s to 1940s due to the frequent air travel between African countries and Brazil, and and it caused increasing Plasmodium falciparum infections. So, and in the last 500 years, there have been numerous examples of transport networks facilitating the rapid spread of communicable disease and epidemics. Uh, uh, regarding and It's like another factor is that it is a well-known fact, and studies have also proven that if we impose travel restrictions in the initial stages of any pandemic, like especially respiratory infections pandemic, then it is a very effective control, and we can achieve effective control of the pandemic. One example I want to give from other sources like newspapers which I read, that there have been some people, some populations who have been the native people of some islands who have never been in contact with the outside world. They have just seen some ships sailing across far off in the sea, or just some airplanes uh, passing over their head. They are very much susceptible to the infections of outside world. So uh, one example is that in the Andaman and Nicobar Islands, the government has imposed on some islands, some part of the island, they have imposed severe restrictions that nobody from outside can go there. Because what the infection we are suffering here, what an infection which is a simple and common cold for us, that can prove even fatal to those populations, because they have been in the so many centuries, they have never been exposed to the outside infection, outside world. So the modes of transport definitely have impact, and because of this, the faster the transport mode of transport is there, the faster uh, the epidemic will reach to that place.
So this is something very true. Yeah, someone wants to add something? No. So this is something very true, that sometimes the development, faster travel, is also causing this kind of pandemics. I just got a message from Dr. N.H. Krishna, who is the founder trustee of Chest Council of India, that today's webinar has a live 1186 logins, almost 1200 logins, and that's a wonderful number. I want to tell another thing, that since the last 3 years this webinar has started, Dr. Krishna has made it a point that every Thursday 7:30 p.m. his clinic closes and he watches this webinar meticulously. And it has become so popular that 3 doctors of Davangere have started opening their clinic from 7:30 p.m. to 10 p.m. that if they can catch some of Krishna sir's patient on every Thursday. So that's something very encouraging. I would want to move on to our dear pediatrician, Dr. Sourav. You live in a zone that is a very hot tourist zone. Lot of tourists cross through your area. So when we are talking about exotic plants, that new plants which are common from somewhere else, and they are being brought to somewhere else, like some tourists come to your area, they buy those plants, flowers from your area, and they plant it somewhere else. Then this new pollen, has this got any impact in children?
Yes, definitely. The exposure and sensitization to pollen, they cause the allergic rhinitis and the allergic asthma. This also triggers and exacerbate asthma, and especially in children. And the higher atmospheric carbon dioxide concentration and warmer temperature, they are likely to increase the pollen levels. And the allergies are associated with increased atopic sensitization, and this can early this one atopic sensitization can lead to asthma. And the pollen counts are also like rising, possibly due to increased CO2 levels, warmer winters, earlier spring, and or nitrogen excess.
So we must recognize pollen. And I remember when our residency, there used to be that history of pollen calendar, and some famous examiners, especially North India, in the practical exam, they used to ask pollen, tell me about pollen calendar. And if you don't know pollen calendar, you should not be a specialist. So whenever we are taking history of recurrent respiratory problem, we must remember this pollen calendar again. Dr. Ravi, when we are talking about this climate change, environment change, and since we are all pulmonologists, we use lots and lots of inhaler. So can you tell about any, let's say, new inhaled medicine or inhalation innovation for, especially for this environment or climate change problem, which you may be using?
Very, very important question, because we write inhalers day in and day out. Significant contribution to the carbon footprint and this greenhouse effect is by the propellants that are present in our inhaler. So nowadays, fewer multinational stalwarts like Astra and Glaxo are coming up with several inhalers which are in the pipeline, which are having zero greenhouse potential. So they are in the pipeline, and they will be able to cause very less of carbon footprint being left. Initially, there were chlorofluorocarbon CFCs based inhaler which were used as propellants, but then they were replaced by HFAs, which are hydrofluoroalkanes. But again, these HFAs are also of two types, one 134A and one is 227A. So they also have a significant greenhouse effect when compared to carbon dioxide levels. So there are some general principles which we environmental friendly pulmonologists can follow. One is, wherever possible, try to use a combination of medicine in the inhaler, so that instead of 2 inhalers, the patient will use only 1 inhaler. So we decrease the carbon emission. Secondly, if the patient is able to manage with a dry powder inhaler, it is better that you prescribe a dry powder inhaler to propellant ka chakkar hi khatam, because that doesn't have any propellant. And third and most important thing is, the best environmental friendly inhaler is used by a person who uses it with proper technique and in a proper way, and his asthma is well controlled with it. So it is
proper inhalational use of a proper method of using the inhaler, which will make our asthma practice more environment friendly.
So one very important message was that compared to MIT, SIT is better whenever we are talking about environment. Second, use the technique properly. Where possible, DPI better than those pressurized MDI. And another, let me mention a drug, because when we are talking about this air pollution, lot of this air pollutant, especially between that PM5 to PM10 or PM2.5 to PM5, they get deposited in the smaller airways. So can there be any role of these kind of medicine, formoterol, beclomethasone, which are supposed to deposit in a smaller airways? Any of you, your experience with this formoterol, beclomethasone, which directly deposits in the smaller airways?
No, definitely. Since you're an iOS pioneer in northern part of India, you are more towards small airway and beclomethasone, this combination. In small airway proven disease on iOS, it has an excellent role. So definitely in isolated such patients, it is having a very good result. But I don't know how to correlate that PM allergy part with the role in small airway disease. That is definitely there. But in some, some smokers, young smokers, definitely that combination is giving very good results.
We
One
have
thing
a
I want to
wonderful
add.
feedback. We have a wonderful feedback. Dr. Vijay Chennamchetty, he wants this quote: butterfly effect. The butterfly cupping and clapping movement somewhere across Europe may trigger a cyclone in the Indian Ocean. That is a small event somewhere. We may not think that it is of any consequence, but that leads to a change of event that may give rise to a calamity somewhere else. Climate change, environment change is like this butterfly effect. We should all remember. Thank you, Dr. Vijay, for this beautiful analogy. I would want to ask Dr. Ashutosh ji, you have done a lot of work in infectious diseases in your area. Any new microbes you are encountering more and more nowadays due to this climate change, environment change?
Since COVID-19, it has been seen that the flu, Streptococcus A, and respiratory syncytial virus infection has increased. To enumerate the bacterial causes of infection according to newer trend or newer after climate change, recently CDC published a yellow book to enumerate from the bacterial causes. It has been there are many of us. One is the Bordetella pertussis is emerging, chlamydia pneumoniae, Corynebacterium diphtheria, H. influenzae, Mycoplasma pneumoniae, and Streptococcus. But Coxiella burnetii and Legionella pneumophila can cause outbreaks. From the viral causes, there has been adenoviruses, coronaviruses, SARS-CoV-2, influenza viruses, measles, mumps, parainfluenza, and rhinoviruses are quite common. One recent case report from West Bengal, that is human influenza, avian influenza in human infection, that is H9N2, in the West Bengal recently in 22nd May in West Bengal. This is only second case after 2019. So after climate changes, we have seen newer infection in most part of the world. Until previously, we are not exposed to that type of infection, but after climate changes, after much traveling, after decreased immunity, there is a lot of newer infection we have not seen earlier, like S9N2 recently detected in the West Bengal in 22nd May. As far as post-COVID, we have seen many fungal infections we are really not used to seeing, like mucor, invasive aspergillosis, even candida. Lot of tuberculosis cases we are seeing after post-COVID. So these are newer changes, newer infection coming back after lot of climate changing, after lot of traveling, more interaction from different group of population.
So one very important message is that whenever we are talking about climate and environment change, anticipate more viral infections, anticipate more fungal infections. So we need to think beyond conventional bacterial infection, think beyond conventional bacterial microbiological tests maybe, to so that we can diagnose these better. Maybe ramp up our labs in the local area. Like virological labs are not present everywhere. But maybe after these problems, we need to start getting more and more virus testing, more and more fungus testing in all parts of the country, rather than sending it to a reference lab where the report will come after 15 days. And maybe in 15 days, a calamity has happened and the doctor may have been transferred to another hospital.
Biofire test may be helpful.
Okay.
Combination biofire test may be helpful.
Something biofire test can be very helpful because turnaround time of it is very less. So that is something great. So whenever we are talking about newer microbes, another thing comes to the mind, newer neoplasms. Dr. Tony, he sees lots of cancer patients, not only lung cancer, but metastatic cancer to the lungs also. So Dr. Tony, would you corroborate any change in epidemiology of thoracic neoplasms with the current scenario?
Dr. Atri, I would like to ask every single participant of this webinar to just think how many times a day they tell to the patient, to every patient they see who may be smoking, to quit smoking. That is like such a common thing for us to say to every single patient. But how many times do we find that some patients don't even have a history of smoking till they have cancer, lung cancer? How many times patients are there who quit smoking till they develop cancer? And how many of them are there who are having malignancy, taking the treatment, but not quitting the smoking? So the cancer still progresses to a worse stage. So when you look at all this background situation of what we face, we try our level best to convince the patient to quit smoking, considering that during our entire PG education, the one thing drilled into our head by our faculty is that smoking is the one factor that causes malignancy. Actually, what we see now is that WHO actually says that 16 to 29% of the global lung cancer deaths are seen in non-smokers, and pollution is the one main factor that is usually seen as a common link. And in 2000, in the entire world, the second leading cause of lung cancer is air pollution at the present point of time. And if you are smoking also and exposed to air pollution, it's a super package, because then you are definitely going to end up with lung cancer, because it is actually synergistic. And in October 2023, last year, there was a review article in the Journal of Thoracic Oncology. It was done by the International Association for the Study of Lung Cancer and Early Detection and Screening Committee. And they are to us. Since 2007, actually smoking has decreased in the world. Overall, air pollution has increased, but still there has been 30% more lung cancer deaths, despite the fact that smoking has decreased. And in 2013, this agency also has declared that, as I said earlier, the particulate matter of 2.5 microns is actually a carcinogen for humans. So that much seriously, the point of air pollution has to be taken. And many of us who feel bad that despite us doing our best, patients develop lung cancer, we have now onwards put more attention on the fact that air pollution also has to be handled as a potential carcinogen itself, other than the smoking that we already handled. Thank you.
So that's a beautiful answer, that rather than blaming things on climate change and environment change, we should first try to correct the modifiable risk factors on ourselves and understand that climate change adds another risk factor to it. So from a single hit, it can become a double hit. We have an audience question, and thank you for dropping in. Dr. Rangarajan from Coimbatore, that can anyone comment about nasal filters? Like someone was talking about mask with filter. So is there any nasal filter available? Dr. Rangarajan from Coimbatore is asking. Anyone of you?
So I think IIT Delhi students had made some, IIT Delhi faculty had made during the COVID pandemic, they had made some nasal filters that have to put worn on the nostrils itself. At present, I'm not remembering the exact make or the cost of that, but and they said at that time that they can even filter the viruses, so you are safe from viruses. So that was like that.
So when we are talking about season change, it is regarding months to 1 to 2 year. Whenever we are talking about climate change, it is a longer trend, maybe 5 years, 10 years, or even more. So this question is to all of the panelists over here, that in the area where you're working, if you grew up in that area or near that area, so how has climate change actually been in your area? How have you felt climate change in your area from when you were a kid to now that you are an adult? Dr. Ashutosh ji wants to answer, please.
There is lot of heat, more time duration of heat, less rain. In last 5 to 10 years, I have seen less greenery, more heat, less rain, more drought. So there is lot of climate change, and no one is worried about it. Even general public, government agencies, NGO, though some people are going to do something for tree plantation, for deforestation, but there is nothing going to happen until as this plant mass forestation, tree plantation drive. There is a lot of climate change in eastern UP or in entire UP. Sudden rise of temperature. This time, for last 15 days, we have witnessed 47, 48-degree temperature in Prayagraj. At least for 10 to 15 days, continuous. You can imagine the situation here in this extreme
So,
heat.
what I understand that the summer is getting hotter and longer and the winter is getting shorter.
Short.
So that's something
And
very
very less rain
important.
also.
Very important. Now I would want to change this question a little to, because Dr. Ashutosh answered, so now the others are eligible. When you were doing residency versus when you are in practice now, any change in the presentation of respiratory diseases during your residency compared to your practice now, which you would want to attribute to this climate and environment change? Any of the others?
Well, definitely, one thing is there that, exacerbations are taking a relatively more time to settle down as they used to before. Means before they used to settle down in many patients in 2, 3 days, but nowadays it takes around 7, 8 days for people to become regular. The use of nebulization as requirement has gone up significantly, particularly in city dwellers. So maybe that could be a part of the climate change or air pollution contributing.
Okay, I got a message from one of our celebrity pulmonologists. Actually, lots of our CCI members, they are doctors of celebrities. They see lots of these film stars, musicians, etc. So I got a message from one of the pulmonologists who is watching this webinar that these nasal filters are actually available. They are available on the internet freely. And today, a senior movie actor took the prescription from this our CCI doctor who was about to take a shooting in a smoke zone, and that senior actor did not want to harm himself or herself, so they actually use this nasal filter before a shooting. So nasal filters are very much real, very much there in India. So that's something wonderful. Now I would want to move on to our pediatrician, Dr. Sourav. Pediatricians are vaccine champions. You push a lot regarding vaccines. So kindly tell us your experience that with these current changes in the climate, has there been any changes in the pediatric vaccination trends? Dr. Saurav.
Especially influenza vaccine, it should be given to the high risk groups, especially 6 months to 24 months age group. Then asthma or wheezing during 2 to 4 years age, asthma requiring oral corticosteroid therapy or immunodeficiency. And the annual vaccination should be done one dose before rainy season.
Thank you for your input. Dr. Tony wants to add. Please, Dr. Tony. Yeah.
What I usually do is the last April, May, before we start the school season, during the vacation, every single pediatric patient, I will give them the influenza vaccination. So once the spring season has started, many of the children have not come back in a severe exacerbation. and they have remained stable now despite that all of us are suffering with heavy rain and climate change getting wet, but still nobody has come back with an exacerbation. So I feel every child should get a vaccination shot before the school season starts.
Thank you. Influenza vaccine is important for children also, adults also, and lots of debate regarding influenza vaccine in current conferences. And I found a very healthy trend. Last 2 years, whatever national level program I attended, they had this dedicated session on this vaccination. That until we push vaccines can never be popular with patients. It is being done wonderfully in pediatrics, but after COVID, lot of adult physicians and all pulmonologists are pushing a lot regarding vaccines. So this is something very good because vaccines are magic bullets that can actually save not only one person, but that entire neighborhood from these calamities. So that is something wonderful. I would want to ask to
Sir,
Dr. Ravi, Dr.
I would
Anirudh,
want,
please. Yeah. Dr. Anirudh, please.
yeah, regarding this vaccine, I want to add something that before the COVID vaccine, the that AstraZeneca vaccine, some news came about that about its side effects just before the election. So before that, it was very easy to convince patients to buy and take vaccines, get administered with vaccines. But just after that, I have been facing too much resistance from almost all patients about the vaccines. As soon as I utter the word vaccine, they become cautious about, they become like apprehensive. So it's like a temporary setback for us because we have been planning for some patients, we have been planning to give some vaccines just after the summer sets in or just after the winter season is over. But as soon as that news came, many patients are not they are not willing. Even some patients just without any reason they are just coming and just asking for some because of the I mean, is it because I had that Covishield or that because I had got that Covaxin? Is it because of that I am getting such problems? Or many patients are asking such questions. So it has definitely given a setback to this vaccination schedule. Earlier, I was doing it very well and patients were being convinced very easily, but now I am facing a lot of difficulty in this vaccination.
No, that I tell to the patient that is only regarding the COVID vaccine. No other vaccine has this issue. Before even COVID came to the market, more than 10, 20 years, people are getting vaccination by this influenza vaccine. Western countries and European countries and Gulf countries, it is mandatory to take a viral flu vaccine. So there's no risk associated with that. Very clearly, I say that there is no doubt in that.
Yeah, we must always respect science, that there is a lot of science going behind any vaccine manufacturing. If we just talk about the BCG, the bacteria that is used in the BCG was subcultured over 1,000 times before it reached the desired property. So just remember, a bacteria being subcultured over 1,000 times, that can take from months to years. So that is how rigorous research is. So if there is a vaccine in the market that has some dedicated science with it, without that, no responsible authority would approve that. So unfortunately, in the era of free internet, we need to fight a lot of misinformation, but we must be the forebearers of society to wherever possible dispel these myths, fight this misinformation that no, vaccines are lifesavers, vaccines are our friends. Dr. Ravi, uh, whenever we are talking about these diseases, let's say with respect to climate change, environment change, often the patient or attendant of patient asks you that is there something that can help my immunity? So what is your experience with respect to immune modulating agents for climate change, etc.?
When a lot of this immune modulating agents, the what is being talked about nowadays, originates from the traditional system of medicine like Ayurveda and Chinese medication systems, and they are derived from species which occur in very environmental tough conditions, like for example microalgae. So from these microalgae, they they extract chemicals which are of various natures like flavonoids, glycosides, polysaccharides, essential oils. And these have excellent antioxidant properties. And now they are being used in the heading of phytochemicals. These phytochemicals are being experimented upon by to fight and counter the effects of climate change. They are being given to people who are going in extremes of conditions. They are being given to astronauts for assessing their properties in outer space, how they help in antioxidant property. So apart from means these phytochemicals have already existed for a long time, but in view of the extreme climate change, we are seeing that they have gained an additional supplementary importance.
So that's a wonderful answer. And the most important thing is we have answers. Means we cannot tell our patient that no, we don't have anything immunity. There are certain medicines which are doing good work. And let's hope by the next physical conference, there may be some topic on this nutraceutical also, like nowadays vaccines have become important. Maybe in future, nutraceuticals will also become important part of conferences. When I was searching the material before planning this webinar, I was getting lots of newspaper articles, some YouTube videos where people were screaming about, crying about climate change. But nowhere I could find any solutions. I'm very happy that my colleagues over here, you're actually giving us a lot of solutions rather than just talking about the problem. So, any of you over here, what may be your solution to combat climate change? Number one. Secondly, what may be your solution to roll back climate change? Any of you, please. Dr. Ashutosh ji wants to answer. Yeah, please.
Thank you. We have to rely more on domestic, like we have to promote cycling in day-to-day life also, not for the for leisure, right? But we have to promote cycling. We have to promote social right, and not public servicing. Public transportation should be promoted in the cities, so that diesel combustion, petrol combustion, fossil fuel combustion should be reduced. Carbon footprint should be reduced. Decreased use of AC can be used. We can minimize AC use. We can design some home this way that we can minimize these things. Less air conditioner, less light use. So if we go more on the nature way, so you can fight with the climate change more of it. And second is that we should plant more trees as much as we can. So these are two main important things so that we can fight. Somehow we can make a change.
So that's yeah, Tony, please, Dr. Tony.
The problem is we have to think, where do we spend, let us say 50-60% of our time? If we are spending that in the house, for example, our children after school, if our wives are not working there at home, the problem is since the pollution is everywhere. Nowadays, even there is a help that even when you're buying a split AC, you will get a PM 2.5 micro filter available from Amazon. So that inside filter, you have to open this thing, change the filter to a PM filter, means your AC itself becomes an air filter for the home. So as long as you use that, the air in the home is of a better quality compared to outside air. But you have to ensure that you have closed the windows properly to avoid recontamination from outside. And if you don't have that facility, you can always go for a separate HEPA filter to filter the air in your, at least you can ensure the quality in your house where you are sleeping, where you're having your daily activities. Then, and an additional thing is there are plants called snake plants. It's a long plant which has very less minimum maintenance plants. Once a week only you have to water it. That you put it everywhere inside your house, including the bedrooms, because that does not need so much sunlight to function, but it really improves the oxygen level within the house. So that, because outside we cannot combat every situation that is going to happen. At least within the house, we should be ensuring our family safety and our safety.
Thank you. What a beautiful advice from all of you. Popularize cycle and planting. Planting is not very costly, and planting actually helps everyone. That's something wonderful. I just got a comment from one of our beloved life members, Dr. Jay Raman from Chennai. Dr. Jayaraman tries to watch all our webinars and he has appreciated all of your preparations on an untouched topic. My question to Dr. Anirudh ji. Dr. Anirudh ji, you did your initial training at West Bengal, then you did some training at Delhi, and now you're at Jaipur. So when you're doing these bronchoscopies, have you noticed any changes that you may want to attribute to this, our topic today, in your bronchoscopy findings over the years?
Sir, regarding the bronchoscopic findings, of course, some changes are already expected in patients who are smokers or who are working in some mining areas or something like that, or who are having cancer, in which we are going to do diagnostic bronchoscopy. But in some patients who were not even smokers, who were young patients, normally the the lumen of the bronchi should be pinkish in color. But sometimes I have seen yellowish discoloration who are otherwise healthy patients, who are otherwise non-smokers. And when we do bronchial wash, sometimes the sample, the fluid comes out cloudy or sometimes darkish in color. So I don't know, maybe it's due to some occupation related finding. I'm not sure about it. But yes, even in non-smokers, young patients, some aberration I have seen.
Thank you.
Yes, sir. I would like to, sir, know the experience of senior pulmonologists and other colleagues also on
Okay.
bronchoscopy. I also,
Uh,
yes,
I
about.
did my post graduation training at Delhi and now I'm working at Ranchi, Jharkhand. The first thing I notice in the bronchoscopy at Ranchi, Jharkhand is that when we go inside, after crossing the tracheal rings, reaching the carina, we are greeted with a beautiful pink color. The normal mucosa we are accustomed to see is pink in color. But when I started doing bronchoscopy at Ranchi, Jharkhand has a lot of these mines, coal mines, iron mines. The first thing I noticed was when I was doing bronchoscopy in a patient, even without a miner's lung, was this loss of this pink color. I was getting a yellowish color mucosa rather than that pink color, or a reddish color with loss of that pink sparkle. This is what I found, that maybe due to this chronic dust deposition, that healthy color of the mucosa is also get changed. This is more pronounced in the lower lobes than compared to the upper lobes. Upper lobes, or the part near the carina, relatively pink, but as we go to the lower lobe, the second or third bifurcation, I am getting more of this, let's say, yellow or orange color. And when I take a lavage from the farthest bronchiole that my bronchoscope can reach, especially in the lower lobe, the sometimes that fluid is of a blackish tinge. This is something which I am getting in Jharkhand. There was one patient, that patient was in fact a relative of a pulmonologist from Delhi, and he was working in some aluminium bauxite mine over here. And there we could send some of that ball via his that the doctor at Delhi, and electron microscope study of that ball was done, where they actually found something, that alumina related granules. They could confirm that. So that is a rare case. We did at personal level, we could not report it. Dr. Ravi wants to answer something, please.
No, I agree with you. And if you do a bronchoscopy of traffic people, traffic policemen, you actually find carbon deposition in the lung. It's actually there, and you can see it sticking. All that pink has changed to black nowadays.
So that's something wonderful. Dr. Tony, a lot of people want to go to vacation to your area, and like whenever my patient, they say that we want to go to vacation to Kerala, and if anything happens there, is there any doctor over there? And I know that there is my dear friend at Kerala. Let us give this guy's number. So Dr. Tony, what advice would you give to a family planning vacation in nowadays this turbulent climate change scenario?
Yeah, that is very true. The word turbulent, because now nowhere in India it is a static climate anymore. In Kerala, especially, the rains are so scattered now. We don't know when it is going to flood. But as a basic protocol, when we tell to the patients, what I usually tell them is if they're traveling to basically the air quality index, just go to Google, put the air quality index word, put the area where you're going to go, put the date. So it'll approximately give an estimation as to what will the climate at that time when they're reaching there. If it looks to be cold or this kind of things, basic thing is number one, if you have time to plan for the travel, take an influenza shot before, at least 15 days before you travel, so that you have the immunity during your travel. Second, you have to see that if you're having inhalers or antihistamine medication, if they are on a, let us say, a step down treatment where they're on SOS antihistamines, better is to make it a regular daily dose for the travel and back, so they don't develop an issue during the travel. Second, next point is if you're having inhalers, if you have kept it at an SOS or if needed basis to use, make it a regular usage for that time of travel to go and come back safely without having any issues. And secondly, and usually I'll give them maybe it's lozenges also to keep in the hand so they can use it for clearing their throat if they feel any chest throat irritations happening. And avoid, as you should, avoid cold water intake and try to have everything as warm and hot food only to avoid additional issues in the climate change area where you're going.
Thank you. That was very crisp and clear. As we reach to the end of the webinar, we can continue this discussion, but time matters. So I would request take-home messages. First, our dear guest, Dr. Sourav, pediatrician, your take-home message which you want to people take away from this webinar. I think he's muted. Dr. Sourav, I think, please unmute yourself. Yeah, clear. Yeah.
We should give advice the children should wash their hands frequently with soap and water. We have to keep the children dry and warm. Then the diet, especially the diet, should be like seasonal fruits, vegetables, and fluids should be given, and avoid exposure to pollutants.
Thank you. That is something very, very clear. I got just another comment. Dr. Rangarajan, he's telling that deforestation is a very big factor responsible for climate change. So yes, we were actually discussing how we can plant even indoors also. We were actually discussing. Dr. Ashutosh ji, your closing comments and feedback message.
Truly, climate changing is going on. We cannot modify much, but we can adopt some healthy lifestyles and decrease carbon footprint, want to decrease, and make some group, make some NGOs, and involve more and more people to give more plantation to nearby area or deforested land area. So last year, for example, I am telling, last year we have planted 11,000 trees with involvement of so many organizations, from Liars Association, from CS Association, from our IMA Association. We planted 11,000 trees last year, and out of 11,000, about 30 to 40% trees are still live. So we can do with the small changes can make a big difference.
So that's a very beautiful message. Even I can correlate. Almost every week means I need to give a talk somewhere as a guest and I'm felicitated. And I found that earlier 2 years ago, they used to give a lot of these showpieces or mementos. But in the last 2 years, almost everyone is gifting plants. That is something wonderful. That is something that must be encouraged. Today, I had a patient. She is a lawyer and she was telling that their Chief Justice, a new Chief Justice was sworn in today, and the new Chief Justice called a meeting of all the lawyers and gave them a target that the Bar Association of Jharkhand needs to plant 2 lakh trees in this monsoon, in the 2 months. They have received this target. So these are something very beautiful things. Another thing that you told, that climate change is permanent. Like earlier, there was test cricket and everyone was very exciting in test cricket. Then when 50 over one-day matches came, everyone was very exciting in that. And nowadays there is 20 over match. So like that, climate will keep on changing. We need to adapt. Like earlier, who was very good batsman in test cricket, they started learning one day cricket. Now they need to learn 2020 cricket for their career purpose. So we must also adapt to this climate change. Dr. Anirudh ji, your
Yes,
closing remarks, please.
sir. As per my opinion, uh, we should all think about where we are spending most of the time in our houses or in our offices, hospitals, and we should like whatever points we have discussed that the places where we are staying and that is part of the climate we are experiencing because most of our times and our many of our patients' time are also spent indoors. So the climate of indoors, we should try to make it as healthy as possible. Like the cleaning should be done properly if you are using any cooling systems, air conditioners. So the cleaning should be done professionally. The professional cleaner should be called once in a while, and it should be clean. And as far as possible, if you are working or our patients are working in any place which has a lot of smoke or dust, something like that, then they should use mask or filters. And in our house, as Dr. Tony has very well explained, that we should try to keep some plants in almost every corner of our house, even in bedroom, snake plants, which can improve the quality of the air. And another thing is that in supplements that moderators, as Dr. Ravi has told us, that we can take those. So this is about that. And also vaccination, we should try to all educate our patients about the vaccination that are available. So this is how we and our patients can fight the climate change on our level. As the government is also doing, some NGOs are also doing. That is.
Thank you. Dr. Tony, your message, please.
Today our entire topic was messages, so I hope everybody is absorbed everything we have told. And I would just like to add a small tip for most of us, as we have discussed, dust being an important factor. Every patient who we are seeing, if we tell them that the normal thing of jadu pocha, don't do jadu, only do pocha. Because when you do the jadu thing, the dust actually flies and it worsens the dust in the house. And either you have to use a vacuum or use a mopping. That is more simple to avoid the dust things worsening. Because many parents will say that despite their cleaning so much, still the child is developing the allergy issues. The problem is because they're not cleaning the dust in the right way. So that is one thing. And otherwise, we have already mentioned everything else. And one request I have to Atri by to please to ask Krishna sir if we can have a CCI tree plantation day where all of us actually plant at least one tree from our side, and we try to help the afforestation purpose that we need to solve this problem.
Yes, sir. Definitely very nice idea. Sorry to speak in between. We should, as a member of CCI, we should set target for every member, at least of few plants. So if somebody wants to plant more, then they can do it. And also we should maintain those plants which we are planting. That would be very good initiative. That would even make our CCI more popular.
So that's a wonderful suggestion, and definitely this should be incorporated. This is a wonderful suggestion. Dr. Ravi ji, your message, please.
Well, first, I would like to thank you, Dr. Atri, for this wonderful moderation. Really, your questions were very in-depth and very apt. Keeping in league with your spirit, I would just like to say that it is the age of AI. It is the age of renewable energy sources available. It is the time when newer innovations are there. Like there is a direct air capture machine. वो कार्बन डाइऑक्साइड निकाल के सीधे आपके सॉइल में दे देता है जहां वो कार्बन डाइऑक्साइड अच्छा होता है. So my point is, let us all be aware ourselves कि AI का क्या ह्यूज पोटेंशियल है क्लाइमेट चेंजेस के लिए, और इस टेक्नोलॉजी को हंसी मजाक में उड़ाने की जगह हमें हमारे बच्चों को और हमें खुद को इसमें इन्वेस्ट करना चाहिए, बिकॉज आई थिंक AI इज हैविंग अ स्ट्रॉन्ग वे ऑफ फाइटिंग क्लाइमेट चेंज. अपार्ट फ्रॉम ऑल दैट एवरीबडी हैज टोल्ड, आई फील वी शुड बिलीव इन ह्यूमैनिटी कि ह्यूमैनिटी ये संकट लाया है, बट ह्यूमैनिटी का माइंड ही हमें इससे छुड़ाएगा.
Beautiful message, beautiful message. One thing which I would want to add on this platform, because there are people watching us from all over the world, decrease plastic usage. We should all think how we can decrease plastic usage. We should advocate decreasing plastic usage. That is something wonderful, because it has been proven that even circulating blood has shown plastic. Fishes from the ocean, then other animals, when their blood has been tested, or sometimes even in patient, it has been seen that even blood has been having microplastic globules. So if we can decrease plastic usage, because plastic does not decay, plastic does not decompose. Even when maybe our species will become extinct, our created plastic may still be there. So decrease plastic usage is a wonderful message. I would want to thank some brainchilds who are involved in the detailed planning of this CCI webinar. Dr. N.H. Krishna, Dr. Narayan Pradeep, they are our founder trustees. They are deeply involved. The current office bearers, President Dr. Ashish Dubey, Secretary Dr. Anil Maske, and there is a team of people, Dr. Vijay Chinnamchetti, who in fact conceptualized this topic, Dr. Kirat Kaur Sibia, Dr. Shivani Swami, and among our panelists, Dr. Ravi Dosi here. These people put in a lot of hard work behind creating these webinars. I would also want to acknowledge our academic sponsor for today, Cipla Respiratory. I would want to appreciate that you are promoting a topic which is saving the earth. This is not promoting any medication. This is not promoting any treatment. But this topic is regarding saving the earth, and your philanthropic drive, Cipla Respiratory, for being our academic partner for this webinar. Then there is a team, Blueberry Service, who is responsible for this wonderful, this audio-visual coordination, because 6 people from 6 parts of India and maintaining the internet connection, everything, that's wonderful. So we need the help of all these people over the last 3 years uninterrupted, that is helping us. And of course, no webinar can ever be successful without the audience. The feedbacks you give us, the questions you ask us. I'm sorry, 4 years. It's 4 years now from we started this in the COVID pandemic 2020 and it's 2024. Since the last 4 years, these webinars are going non-stop. So all of you who are giving your 100%, then our audience, around 1,200 people are watching this webinar today. And this is not a, let's say, a hot pulmonary topic. We are not discussing some new inhaled medication. We are not discussing some new intervention. Still, all of you love for our planet that is making you watch. So a thank you from all of us here as Chest Council of India. We are always there to listen to you. We are always there to get new feedback. Like we got some beautiful feedback today. So in future also, if you think there is some topic, Dr. Atri, I am here. Dr. Ravi Dosi is here. Dr. Vijay Kumar Chennamchetti, Dr. Kirat, we are always there. Dr. Shivani, Dr. Krishna sir, Dr. Narayana, we are always there. Please give us your message and we will ensure that your topic will be a CCI webinar. There is no good topic. There is no bad topic. We will work hard to make every topic a good topic. So thank you. Good night, everyone. Have a fantastic evening.
Good night, everybody.
So good night, everybody.
Good night, everyone. Good night.